Good morning. This is Dr. Anthony Lordo, your go-to dentist in Worthington, Ohio. I'd like to take a few minutes of your time to update you on the office, as well as, give you a little hint on how to deal with stress in these challenging times. Our office will be limiting itself to emergency dental treatment only until April 7th. Please, Lori, our office manager, is working from home and can catch your phone calls as well as get in touch with me, and we can find a time to take care of your emergencies. Well, golly, you may be thinking, what's an emergency? Well, anything that has to do with infection, swelling, severe pain, a broken restoration that's cutting your tongue or your cheek, or when in doubt, give Lori a call. She'll go ahead and help triage the situation. Also, we could do TeleDentistry. Well, what's that? Everyone has an iPhone or an Android. Have a friend of yours or a spouse, take a picture of your broken tooth or whatever problem you have, and then simply email it or text it to me. Again, Lori can help you do that. Just give her a call, 614-885-4754. And you can always jump on our website to get our contact numbers. Again, we hope to open our doors April 7th to routine normal dental care. We've already taken steps to increase the number of team members that'll be here to serve you. We've also taken steps in the office like a deep cleaning with sterilization, as well as having all of our carpets professionally steam cleaned. When the governor says we're good to go, we're ready for you. I'd like to give you a little pointer that so many of you may have heard in the past, and that is, clenching and grinding. I've always said that there are 5 major stressors in a human being's life, and they kind of go like this. Weddings and funerals, travel plans, even if you're going on vacation, moving your house, and moving your job. Those are some of the main stressors in a human being's life, I've found. And those stressors can cause people to clench and grind when their muscles and teeth are in disharmony, a little worse than usual. I think I have to add one of those major stressors now, and that's this darn pandemic. So I've noticed it's causing a lot of stress on folks. So remember, your teeth should only touch when you chew and when you swallow. Unfortunately, many of us walk around with our teeth clenched together, especially when we're driving, concentrating, and working on that computer. Now remember, your teeth are only supposed to touch when you chew and when you swallow. So the moment you feel your teeth touching, I want you to kind of upright your posture, especially if you're working from home on those computers. Make sure your chest's out, your butt's out, your elbows are in, and you want that screen to be at the same level as your eyes. That way your neck is in a nice neutral posture. What I've noticed about the ladies when they're here working, in the morning, 8 o'clock, they sit up nice and straight, and by 5 o'clock, they kind of look like gargoyles, kind of all bent over. Well, that's because we're tired. And when you have bad posture, that can make you clench and grind more. So, I'm going to teach you a little trick that Dr. Jeff Okeson taught me many years ago. And that's a simple exercise called blowing air through your teeth. So, the moment you feel your teeth touch throughout the day, take a nice deep breath, and simply exhale through your lips and your teeth. It's not huffing and puffing, it's not Lamaze, we're not having babies, we're just simply exhaling. Most folks won't even know you're doing it. Heck, I've done it in board meetings and didn't even know I was doing that to kind of keep myself from clenching and grinding. When you do that, 3 really good things happen. First, you become very aware of how often your teeth are actually touching. Remember, they should only touch when you're chewing and when you swallow. Second, it's kind of the whole yoga thing. Blow out the bad. Have a nice exhale. And third, if you blow air through your teeth, your lips, your teeth don't touch. Your teeth can't touch, you can't clench your muscles. If you can't clench your muscles, you can't hurt them. You can't hurt your teeth, you can't hurt your jaw joint. Now at night, you can't really control that. And that's where maybe a night guard or a protective orthotic may come into play. Once we're back to full speed, just give us a call, and I can help you make some good decisions, as well as screen for other jaw joint problems. So remember, in these challenging times, wash them hands. Also, remember, those teeth should only touch when you're chewing and when you're swallowing. When in doubt, simply blow air gently through your teeth. I have a nurse that's working Southern Ohio right now, and I taught her this exercise a few years ago. And she goes, Dr. Lordo, I find myself walking down the halls, blowing little kisses at people all day long. Well, golly, I guess that's a good way to look at it. So, from Dr. Lordo and his team here in Worthington, wash them hands and keep smiling.